Hi, this is Dr. Mohammad Faizan Fazel, and today we will learn how to determine whether a rhythm is normal sinus rhythm. We already know that SA node acts as the natural pacemaker of the heart. It generates electrical impulses which repolarize different chambers of the heart and contract them. But how the SA node acts as the pacemaker? Well, the SA node consists of a cluster of cells, the myocytes, which are myogenic, meaning they have the potential to generate electrical impulses without having any input from nerve fibers. Even if you cut off all the supply to the IC node, it will still keep on generating electrical impulses. Now one may wonder why it's just the SA node and not AV node and Purkinje fibers acting as a pacemaker, even when they are part of the same conduction system. Well, the intrinsic heart rate of SA node is around 60 to 100, while that of AV node is around 40 to 60, and that of Purkinje fibers is around only 20 to 40. So you see, the SA node has highest intrinsic heart rate of around 60 to 100. The Purkinje fibers have highest conduction velocity, but the SA node has highest intrinsic heart rate. So the SA node overdrives the whole conduction system and acts as the natural pacemaker. Now coming back to our main topic, that is normal sinus rhythm. For a rhythm to be a normal sinus rhythm, it must fulfill a few criteria. All the P waves should have similar P wave appearance, and all the P waves should be at regular interval. Here let me quickly draw the conduction system of heart. We already know that P wave represents atrial depolarization, and since the atrial receiving electrical impulses only and only from the SA node, only one pacemaker, that's why all the P waves should have similar appearance. And since the impulses are coming down to atria at regular intervals, that's why the P waves should be occurring at regular intervals too. The second criteria is P waves should always be before QRS. P before QRS, and QRS should always be following P wave. Well, the impulse that depolarize the atria now will relay in the AV node, and through bundle branches will depolarize the ventricles. The same impulse that depolarized atria now depolarizes ventricles. So P should be before QRS and QRS should be after P. The third criteria is regular R to R interval. Regular R to R interval. Well, here again, as the impulse is coming down from the SA node as regular interval, and if there is no defect in the AV node and bundle of his and bundle branches or Purkinje fibers, the same impulse should be depolarizing the ventricles at regular intervals. That's why QRS should be occurring at regular intervals too. And the final criteria is P wave should be positive in lead 1 and lead 2. Positive P in lead 1 and lead 2. Well, let me explain it here. Let's suppose this is our patient. In a 12 lead ECG, the best leads to visualize SA nodal activity are the limb leads. The red lead goes on right arm, the yellow lead goes on left arm, green one goes on left leg, and black one goes on right leg. Well, this color coding system is different in the USA, but here we are following the European color coding system. Now we have already learned that any electrical activity that is directed in the direction of this cardiac vector will produce a positive wave, right? The electrical vector of lead 1 is directed in this direction from right arm to left arm, right? And the electrical vector of lead 2 is directed in this direction from right arm to left leg, right? Now, lead 1 vector is directed leftwards and uh, downwards, not downwards but leftwards, yes. So it will produce a positive wave. And similarly, the electrical vector of lead 2 is also directed in the direction of cardiac vector, leftward and downward. So it will also produce a positive P wave, right? So for a rhythm to be a normal sinus rhythm, P waves should be positive in lead 1 and lead 2. Now let's apply this criteria to our ECG here and see if that's a normal sinus rhythm. Similar P wave appearance. These are P waves, and yes, they look similar. Regular P to P interval. Here, let me bring out my cardio caliper here. This is a cardio caliper. Let me adjust it here on P waves. This is the P to P interval in the first heartbeat. Looks same, almost same. Yes, P to P interval is regular here. The third criteria is a regular R to R interval. Let me adjust it here again on R waves. This is the R to R interval, and yes, it's regular. The final criteria is positive P wave in lead 1 and lead 2. This is lead 1 and these are P waves and they are positive. This is lead 2 and here again positive P waves. So our rhythm here is a normal sinus rhythm. Let's practice this on another ECG. So this is our second ECG and these are P waves, and yes, they look similar to me. Now let's see if P to P interval is regular. Let's adjust the cardio caliper on P waves. So this is the P to P interval in the first heartbeat. Same again. Well, here it has deviated a bit, but that's because respiration has effect on our heart rate. When the heart rate changes, the interval change too. We will learn that in the next lecture in the sinus arrhythmia. But here let's see if other P2P intervals are regular. Almost same, almost same, almost same. Here again it has deviated a bit because of respiration. Yeah, a little bit deviation. Similar again. Same interval again. Same interval again. So yeah, the P2P intervals are regular. Now let's see if R to R intervals are regular or not. So that's the R to R interval, and it's same here. That little bit deviation because of respiration. Not little bit, but yeah, that's because of respiration. Trust me here. Almost same. A little bit deviation again because of respiration. And yeah, a little bit same deviation again. Similar here, same interval here, and same interval here too. So yeah, R2R intervals are regular too. And let's see if final criteria is fulfilled or not. So this is lead one, and yes, P waves are positive. Hard to visualize, but yes, these are P waves. This is lead two, and P waves are positive here again. So this ECG is also a normal sinus rhythm. Let's try it on another ECG. So these are P waves, and well, these are negative in lead 2, and yes, negative in lead 1 too. Not that much noticeable in lead 1, but yes, these are negative, so that's not a normal sinus rhythm. The P waves appear similar in shape here, and the P to P and R to R interval may also be regular. I haven't checked that, but since P waves are negative in lead 1 and lead 2, so that's not a normal sinus rhythm. That might be an atrial tachycardia, but for today we have ruled out that this is not a normal sinus rhythm, and that's enough for today. See you in the next lesson.